Key findings from 2018-2019 Uganda Malaria Indicator Survey. The 2018-2019 Uganda Malaria Indicator Survey, or UMIS, is designed to provide up-to-date estimates of basic demographic and health indicators related to malaria. The 2018-2019 UMIS is the third malaria indicator survey to be carried out in Uganda as part of the Demographic and Health Surveys, or DHS program. 8,351 households and 8,231 women aged 15 to 49 were successfully interviewed in the 2018-2019 UMIS. This represents a response rate of more than 99% for households and 98% for women. All children aged under 5 living in selected households were eligible for anemia and malaria testing. Anemia testing was carried out using the HemoQ system. Malaria testing was done through both rapid diagnostic testing, known as RDT, as well as blood smear microscopy. Of the 7,311 eligible children, around 97% provided blood for anemia testing, RDT, and malaria microscopy. Malaria prevalence estimates in this video are based only on microscopy results. The 2018-2019 UMIS provides estimates at the national level for urban and rural areas for each of the 15 regions in Uganda and for 14 current and 11 past indoor residual spraying intervention districts. Refugee settlements in 9 northern and western districts were included as a separate sampling domain. The results of the 2018-2019 UMIS show much progress in malaria prevention and case management since 2009. Currently, 83% of households in Uganda have at least one insecticide-treated net or ITN. An ITN is a factory-treated net that does not require any further treatment. The definition of an ITN in surveys before the 2016 Uganda Demographic and Health Survey included nets that had been soaked with insecticides within the past 12 months. ITN ownership has increased slightly since the 2016 UDHS, when 78% of households owned at least one ITN. Although ownership of ITNs is widespread throughout Uganda, only 54% of households have enough ITNs to cover each household member, assuming one ITN is used by 2 people. 3 in 10 households have at least one ITN, but not enough for all household members, while 17% of households do not have an ITN. Access to an ITN is a calculation of the proportion of the population that could sleep under an ITN if each ITN in the household were used by up to 2 people. 72% of the household population in Uganda has access to an ITN, and 59% of the population slept under an ITN the night before the survey. Both indicators have increased slightly since the 2016 UDHS. Children under 5 and pregnant women are the groups most vulnerable to malaria. 6 in 10 children under 5 and 65% of pregnant women slept under an ITN the night before the survey. Use of ITNs by both children and pregnant women has decreased since 2014-2015 and has stagnated since 2016. Malaria during pregnancy contributes to low birth weight, infant mortality, and other complications. To prevent malaria, pregnant women living in Uganda should receive 3 or more doses of SP Fansida during their pregnancy. 89% of pregnant women received at least 1 dose of this intermittent preventive treatment, or IPTP, while 72% of women received 2 or more doses, and only 41% received 3 or more doses. Pregnant women receiving at least 3 doses has more than doubled from 17% in 2016 to 41% in 2018-2019. Fever is a major symptom of malaria in children. In Uganda, parents were asked if their children had any fever during the 2 weeks before the survey and if they sought medical help. Currently, 87% of children with recent fever had advice or treatment sought, a slight increase from 81% in 2016. Half of children with recent fever had blood taken from a finger or heel for diagnostic testing. Diagnostic testing has increased from 17% in 2009 to 51% in 2018-2019. Anemia is defined as a reduced level of hemoglobin in the blood. In the 2018-2019 UMIS, 4% of children under 5 have low hemoglobin. The prevalence of low hemoglobin has remained stagnant since 2014-2015. In Uganda, 1 in 10 children under 5 tested positive for malaria by microscopy. Malaria prevalence varies greatly by region, ranging from 34% in Karamoja district to less than 1% in Kampala and Kigezi districts. As you can see, the 2018-2019 Uganda Malaria Indicator Survey provides a wealth of information about malaria in Uganda. Results of the survey show where progress has been made as well as areas for improvement. The 2018-2019 UMIS provides data to inform strategic planning and program evaluation in Uganda. The 2018-2019 Uganda Malaria Indicator Survey was implemented by the National Malaria Control Division, NMCD, and the Uganda Bureau of Statistics, UBOS. Financial support for the survey was provided by the United States Agency for International Development, USAID, through the President's Malaria Initiative, PMI, the United Kingdom Department for International Development, DFID, the Government of Uganda with Global Fund support, and the World Health Organization, WHO. ICF provided technical assistance through the DHS program, a USAID-funded project offering support and technical assistance in the implementation of population and health surveys in countries worldwide. For additional information on the results of the 2018-2019 UMIS, please contact the National Malaria Control Division in Uganda and the DHS program in the United States.